So the Berm is what we're calling an area between two earthen mounds on the Jordanian-Syrian border, where 75,000 refugees have accumulated since the border was tightened up and finally closed on the 21st of June after a bomb. So it's not a refugee camp. There's no intrinsic water supply. There's been one food drop since the 21st of June, and there's no meaningful access to healthcare. It's a very dry and desolate place, very arid, and temperatures are going up to 50 degrees. So MSF had access to this population between the 16th of May and the 21st of June. We saw 3,500 patients, of whom 450 were pregnant women. 25% of the patients we saw had acute watery diarrhea. We saw lots of respiratory illnesses, skin conditions, things that you would expect in people that were existing in this kind of austere environment. And we did see some severe acute malnutrition. We don't know what the current health needs are in the Berm because we haven't had access to this population for 2 months. What we know is based on what we saw before and on unverified information that's come out since then. We're pretty sure there's a hepatitis outbreak. MSF saw 6 cases of jaundice when we were operational, and now we hear that there's many, many cases of jaundice, including some deaths. There's 450 pregnant women without access to healthcare, and we have had unverified reports of deaths in childbirth, which would be expected in this context. The diarrheal situation won't have improved in the context of limited water and sanitation and up to 50-degree heat. So we don't know, but we know that it's not good. MSF is calling to have access to this population to assess what the current health needs are and to provide basic healthcare and reproductive health as we were before. And we're ready to go.